So if we have a patient with acute lower back pain, ask the patient just to walk into the table like that, please. And make yourself comfortable like that. And then we just use the table tilt to get him or her in a prone position. So first, when I have the patient on the table, I'll ask the patients to lift their legs so I can adjust the support comfortable for their feet, like this. I can feel the joints one by one. If there's any difference in the, let's say, range of motion, or I can ask the patient if there's any pain on either left or right side. And also I can feel with my hand if the movement of the spine is symmetrical. And then when we're done with the lateral side of examination, we can add the flexion and extension. I open up this lever, so I add extension or flexion, and I can do the same examination again. When I start to do the manual therapy treatment, I can, for example, have the back muscles on my other hand and then do the flexion and lateral flexion at the same time, so that I have lots of good motion and also the manual therapy done at the same time. Next thing that we can do is have some treatment on the back muscles and the joints there with the rotation. So I grab the other side of the table, I opened up the rotation part, and then I'll do the rotation here. So basically this is really easy for me. I just grab the muscle and pull the other end, and I can add some great movement and manual therapy on the lower back. If I want to have some traction done, I can open up the traction part and use whatever techniques I want to mobilize the lower back here. I like to go with the cross position like this. And also now, if I wanted to make it even more efficient, I can have the tilt a bit more there and then more flexion here, so I can make it even more efficient here. And for the thoracic section, I like to make the table a bit lower so that I don't have to I can use my own body weight to do the treatment. I open up the lever here, and then with my other hand I do the movement. With my other hand I keep the pressure on the spinosus. I can go either in a bigger parts like this, or I can do the treatment. If I want some specific treatments done, I can do it segment by segment here on the patient's back. And then when I want to add the flexion and extension, the knob there, I can have real nice manual techniques done here at the upper part of the spine. For the cervical spine, we can open up the lateral movement here, like this, and we can either do the manual work with the patient on their stomach, or I prefer better on their back. So for the cervical spine, first what we do is we adjust the head part in the right position so that the spine is straight and I can still have my hands under the head. So I don't have to carry the head, but still we get the right position here. I can do some lateral movements here with my other hand doing the manual work here at the spine. Or I can have some traction done, pull and turn so that I have the traction open. There's lots of different techniques what you can use to do the traction, but I prefer to have my hands under the skull. We can do some shoulder joint mobilization here. So first I have asked the patients to turn their palm up so that we have the shoulder, and I can have the humerus on my other hand, and then we have some real nice manual therapy here done. If the patient has a lack of movement, range of motion here on the shoulder, this is an easy way to do it. If we want to focus on the lower extremities, legs, it's easy to when we have it all here in front of us. Or we can just have some nice joint play here for the thoracic spine to feel, just to get the whole of the feeling. Is there stiffness here, and in which part, and is it left side or right side, and things like this. Thank you.